Hey everybody, Dr. Scott and Dr. Brittany. We're here to show you the first step after you have your breath control rocking, okay? So in that first video, we showed you how to breathe through your abdomen, belly breathe, using the diaphragm and the pelvic floor, okay? So once you have that down, we're gonna move into this first progression. She's going to lay on her back and brace her core. So kind of like act like you're about ready to get hit in the stomach, or like when you laugh really hard, those muscles all contract. That's first step. Second step is lift her legs. And you'll notice that Dr. Brittany does an awesome job of having her knees wider than her feet, okay? She can bring her legs up or back, kind of wherever you're feeling comfortable. Your lower back should be pressed lightly against the floor. You should be able to maintain this position, okay? This is literally step number one. If you can hold both of your legs up like this and continue to breathe through your belly, work on this. 5 seconds at a time, 10 seconds, making your way up to a minute or two in this position would be a really awesome thing. Okay, without any compromise in how your spine is. We don't want hyperextension in the low back. We want that diaphragm and pelvis to always remain parallel to one another, just like you see in her right here. Okay, take a little break. After that, basically what we're gonna do is go back up into that position after she takes a short break. Arms up. She's gonna put them in this position like she's giving a big hug to a big ball. And then she's gonna start putting movement into this. So what she's gonna do is lower her right leg as far, and actually, honestly, just a few inches to start, just a few inches. Okay, alternate to the left leg. And again, what you want to focus on is good stabilization of those core muscles. The back should not hyperextend, and also pay attention to the front of your belly. If you just had a baby, if you're postpartum, or men, if you notice there's some coning or bulging in the front of your belly when you do this, you do not want to push this too far. Just go down with your leg to before the point that starts to happen, and really focus on that breath work. That coning is a weakness in the front of that abdomen, so this kind of work is really going to be good for you. You just have to make sure you don't push it too far. Okay, so as she alternates legs, she can move down a few inches at a time, but honestly, you never really probably want to go past about the halfway point at this time, okay? Do you need a break? Take a break, or are you good? She's good. Okay, so the next thing she's going to do is work on arm movement. So one arm at a time. She's going to lower slowly towards the floor, and the opposite arm. We're going to work up to doing 20 repetitions of each of these. Start with what you can. And then the last and hardest movement is going to be the actual dead bug, where she starts with one leg and the opposite arm, moving down just inches at a time.
Can I add something?
Yeah, and Dr. Brittany wants to add something.
So as you're maintaining this position, you want to continue to check in on your core. Because the longer I stay here and the less I think about it, the more it starts to relax. And you want to make sure that your core stays tight the whole time. So each second that I'm sitting here, each movement that I'm doing, I'm continuing to check in on my core and think about it and re-engage and tighten that core again, kind of resetting and pressing my low back firm into the floor before each movement.
Yep, that's a great point. Like we said, keep the pelvis and the diaphragm in a parallel position, and the minute they start to extend or break, you want to reset yourself. Take a short break and come back to it. So 20 repetitions of each of these, and you're going to be off to a great start.